May is National Stroke Awareness Month. Stroke is the leading cause of long-term disability and the second leading cause of death in the United States. Here are the latest frightening statistics from the American Heart Association and the American Stroke Association. There are approximately 800,000 new strokes annually, and there are approximately 100,000 deaths each year caused by strokes. By the year 2030, 1 in every 25 adults will suffer a stroke, which translates into 3.4 million individuals. A stroke prevents sufficient blood flow to an area of the brain, causing damage to brain tissue. The brain requires oxygen to survive, and oxygen is supplied to the brain through blood flowing through and circulating in the brain through blood vessels. When there is a blockage in the blood flow, a clot develops, preventing the delivery of oxygen. This blockage and disruption in the delivery of oxygen causes rapid death of brain tissue, causing a stroke. We are frequently called upon by stroke victims to determine if their case fell below acceptable levels of care and determine whether their physician, an urgent care center, or their hospital emergency department committed malpractice. Stroke malpractice claims fall into two major categories: failure to diagnose and failure to treat. Failure to diagnose can result from an inadequate history, failing to heed the information obtained, failing to perform an adequate and thorough exam, or failing to heed the findings of a neurological examination. Failure to treat can result from failing to timely administer medication to dissolve a blood clot, or failing to perform emergency surgery to remove the blood clot. The saying, "time is brain," is an important reminder of the critical nature of rapid treatment for stroke. When a person experiences a stroke, blood flow to the brain is interrupted, which can cause brain cells to start dying within minutes. And the longer it takes for the person to receive medical attention, the greater the damage to the brain becomes, and the worse the long-term outcomes are likely to be. Every second counts regarding stroke treatment, and the faster a person can receive appropriate medical care, the more likely they are to have a positive outcome. It's important to take a proper history and perform a thorough neurological examination in the emergency department. Delays in diagnosis can result in tragic consequences. The recognized signs and symptoms of a stroke are sudden numbness, tingling, weakness, or loss of movement to the face, arm, or leg, sudden vision changes, sudden speech difficulty, sudden confusion or trouble understanding simple sentences, sudden dizziness or problems walking or balance, sudden or severe headache. Family and friends must be able to recognize these signs and symptoms so an individual can be rapidly transported to the hospital for treatment. The acronym F.A.S.T, F.A.S.T, facial drooping, arm weakness, speech difficulties, and time to call 911 has been used by the National Stroke Association, the American Heart Association, and others to educate the public about symptoms of a stroke to aid in rapid recognition and timely intervention. Seeking and receiving immediate and proper medical attention when a stroke is suspected can reduce damage to the brain and improve the chances for a good recovery. Thank you for listening today, and I look forward to you joining me next week on a new edition of the Brain Injury Insider.